Hi, welcome to Case of the Day, and today we're on our 38th case, the vascular groove, dark rim, and arterial enhancement signs of an osteoid osteoma. I will only do one more tomorrow, and I'm traveling on Thursday. So, the concept being that it has to be a case that I've seen reported the same day will not work. And so, I'll do case 39, and then case 40 will be next Monday. So this 21-year-old presented with a long-standing history of pain in the right knee and a presumed diagnosis of a proximal tibial osteoid osteoma. This is a radiograph taken about 2 or 3 years ago showing this elongated osteolytic lesion, lot of sclerosis but no cortical thickening or periosteal reaction. It's been present for 10 years with intermittent pain, sometimes at night, and you can see the CT showing an elongated osteolytic juxtacortical or rather an endos. It's actually a peripheral eccentric marrow lesion. It's not even involving the cortex. There's one eccentric focus here, there's marrow edema. Um, and there's no cortical break, no periosteal reaction, doesn't extend up to the articular surface, and more or less unchanged for 10 years. So, this absence of change, right? So, if you had any tumor apart from an osteoid it would grow, including osteoblastomas. And if you had an infection, it would change character, right? It's either increase in size, you'd get a cortical break, some abscess, none of that is there. And so these findings, more than anything else, will tell us that this is consistent with an osteoid osteoma. But this patient has other positive signs that allow us to make a diagnosis. This is called the vascular groove sign, where you get these vessels extending from the lesion outside. And this is even more important when we're looking at subtle cortical lesions to make the diagnosis. First described in 2011 by Patrick Liu. It hasn't been written up much, but we see it ever so often on CT. So that's the vascular groove sign. Then we have the dark rim sign, which was described in, I think, 2022 and maybe a little earlier. Again, more important when we're looking at subtle lesions because it gives us a clue that this might be an osteoid osteoma. But here you see the dark rim, and that's part of the sclerotic rim that we see with osteoid osteomas. And this was the original article that mentioned it, and there's been a couple of follow-up articles earlier this year. So that's the dark rim sign. The third is we did a dynamic contrast study. You can see the artery here. That's the arterial enhancement. Lags a little behind, which often happens with osteoid osteomas, and it doesn't drop as quickly. But this is an arterial enhancement pattern, and you see that those vascular grooves are also showing the same pattern of enhancement. And while we've been doing this since 2003, it hasn't really been formally written up very well. This 2017 article is a good one to go through if you're not using dynamic contrast for osteoid osteoma. So these three signs are very characteristic of osteoid osteoma apart from the standard other findings. The only thing here was that it was a marrow medullary lesion rather than a cortical lesion. The other thing to consider is that, the intra-capsular lesions, this article is just wrongly labeled. Intra-articular has to be along the articular surface. If you have a lesion that's intra-capsular, and that would still be extra-articular. So I don't know how the editors didn't look at this. But when you have an intracapsular lesion like ours, you would get absent cortical thickening and periosteal reaction and more sclerosis. So, which is why the lesion looks a little atypical and doesn't show those classic appearances that we would see otherwise with regular osteoid osteomas because it is intracapsular. I have twice on bstneoplasms.com discussed osteoid osteomas. One was this intracapsular, the other was a standard one. This is all free, so you can just go ahead and go through these. The links are there, and I think one of these videos is on YouTube. I'll put up the link at the end, once I find it. That's the leadership program if you're interested. That's my WhatsApp channel. Thank you so much for viewing this. Have a great day, or great day tomorrow.